Hi, I'm Dr. Nishant Yagnik. I'm head of neuro and spine surgery in Fortis Hospital in Manesar. So, Kenneth came to me in Zambia actually. Kenneth was the kind of person who you bonded with immediately. We joked a lot, and he was a very hilarious gentleman for his age. He had gone through a lot. He had underwent a pituitary surgery back in Zambia, which had messed with his hormones very badly. He has also underwent a hip replacement and a spinal surgery before. And now, when he came to me, he was in such severe pain. It was very interesting how he managed to mask that pain with humor. But to tell you the truth, he could barely walk.
My name is Kenneth Msapenda, a Zambian citizen living in Zambia. I got this terrible foot pain and back pain some time ago. And this is my wife. One time there was an advert in the paper somewhere that a certain doctor, a certain Dr. Yagnik would be talking to patients with spinal column discs pressing on nerves. I had my nerves pressed for the foot. I went there, saw him, saw the Duchamps and Sereta, and we agreed that I should come here for an operation to solve the issue. I believe it has been solved.
So when Kenneth came to me in India, he sat outside my OPD, and this was 2 months after I'd seen him in Zambia. We'd not had any communication in between. And the first thing he said to me was, "Doc, I'm here to lose my stick." And I promised him that he would by the time he goes back.
My husband and I were immediately taken to see the neurosurgeon who was supposed to perform the surgery here, and I was very impressed about him, about the team that he had there, and I think talking to him also allowed us to lose a lot of fear what would happen. We were very confident after talking to him.
Kenneth was a tough patient for us from multiple levels. First, we were doing a surgery which was complex on a spine that had already been operated in the same area. But we are a center of excellence in this regard, and that is a challenge we've taken up many times. What was even more challenging was the fact that he had a pituitary tumor that was still there despite his previous surgery, and he had multiple hormonal imbalances because of this.
The decision to travel to India was not a very easy one because you get scared, you don't know anybody there, you have never been there, how is it all going to work? Anyway, we did the step, we arrived here, and I have to say that people here, they have been looking after us in a great way. I'm so happy, even though we don't have family or friends here, at least we had the support. We had the support of people here in the hospital, and I'm very grateful for that.
Due to his hip replacement, he was also having a bit of instability at the hips. So we took him up for the surgery, and it went splendidly well. We replaced the implants that he had placed in Africa before. They didn't seem very good, with state-of-the-art titanium implants, and we made sure that all his nerves are decompressed under microscopic and endoscopic guidance. Post-operatively, the patient managed to sit and stand from day one. There was pain from the surgery itself, definitely, which took a few days, but by the third day, he had lost a stick. He was barely using any support anymore, and he could walk much longer. Earlier, he could walk only a few steps and then needed to sit. Now he was going front and back across our corridors, very happy.
I have also to say, I was amazed about how quickly actually my husband was after the operation, how quickly it went, because he could stand up. The second day after the operation, he was walking his first steps. That I found very amazing, and even that his pain was gone, because my husband has lived with this pain more than 30 years.
We wanted to discharge him, and when we did discharge him, he actually had an episode of dementia. Because of this episode, which was not known to his family, we had to bring him back because his family had seen him have these episodes of not being able to recognize people and other things, but they did not have any specific knowledge or treatment about it. Previously, he was taking medications that he didn't have any idea about. So we brought him back, we worked him up for the dementia again. We stabilized his medications, and in another 2 to 3 days, he is now stable from another problem that he didn't even know about before he came here.
And of course, over the years it got worse, and it's gone now. So it's amazing, and I hope that now the quality of life for him is going to be better. We can even go on walks, which we couldn't do before. We can enjoy our lives, and we know very well that we have to thank this hospital, the staff here, of course, the neurosurgeon, Dr. Yaknik, for it, and we are very happy that we had this opportunity. We would really recommend to anybody who has to go to India for an operation like that.
I will recommend.
Yes. We were very, very happy about this.
I am not happy, I am impressed.
Yes, that's true.
So we've treated him essentially for both his spine, made him stronger, and his dementia, which has made his quality of life much, much better. So he's flying back today, and we've had a wonderful conversation with him, and I hope the best of luck to him and his wonderful family, and to all patients who require our help. Thank you.
I would like to say that we are more than appreciative to all the staff, the people of this hospital, hotels, and of the country. I say thank you very much.
Yes, thank you very much.